If you've noticed swelling in your legs, unexplained pain in your calves, or a feeling of heaviness that won't go away, you might be dealing with something far more serious than simple fatigue. Blood clots in your legs are silent threats that can turn deadly without warning. Yet most people have no idea there's a natural vitamin that can help dissolve these dangerous formations and protect your circulation. I'm Dr. Susan Parker, wellness and longevity advocate, and today I'm revealing the scientifically proven vitamin that works alongside your body's natural clot-dissolving system, how to use it safely, and the critical signs that mean you need immediate medical attention. Let me be absolutely clear from the start. If you currently have symptoms of a blood clot, sharp pain in your leg, sudden swelling, warmth, or redness, you need emergency medical care immediately, not vitamins. Blood clots can break free and travel to your lungs, causing a potentially fatal pulmonary embolism. What I'm sharing today is prevention and support, not emergency treatment. Always work with your healthcare provider, especially if you're on blood-thinning medication. Now, here's the vitamin that research shows has remarkable clot-dissolving properties. Vitamin E, specifically in its natural form called D-alpha tocopherol. But here's what almost no one tells you. Not all vitamin E is created equal, and taking it incorrectly can be completely ineffective or even harmful. The form matters, the dose matters, the timing matters, and combining it with specific nutrients multiplies its effectiveness exponentially. Vitamin E works through several mechanisms that directly affect blood clot formation and dissolution. First, it acts as a natural blood thinner by reducing platelet aggregation, which means your blood cells are less likely to stick together and form dangerous clots. Second, it protects the lining of your blood vessels from damage, and damaged vessel walls are prime locations for clots to form. Third, and this is the part most people miss, it supports your body's natural fibrinolytic system, the built-in mechanism that dissolves clots. Your body produces an enzyme called plasmin that breaks down fibrin, the protein mesh that forms the structure of blood clots. Vitamin E enhances this natural process, making your body more efficient at dissolving small clots before they become dangerous. It's not replacing your body's system, it's optimizing it. The research backing this is substantial. Studies show that people with higher vitamin E levels have significantly lower rates of deep vein thrombosis, the medical term for blood clots in leg veins. Other studies demonstrate that vitamin E supplementation reduces markers of blood clotting activity in at-risk populations. And clinical observations consistently show that adequate vitamin E intake correlates with better overall vascular health. But here's where most people go wrong. They buy synthetic vitamin E, labeled as DL-alpha tocopherol, which is far less effective than natural D-alpha tocopherol. The synthetic form is actually a mixture of 8 different isomers, only one of which is identical to natural vitamin E. Your body preferentially uses the natural form and partially discards the synthetic versions, meaning you're getting a fraction of the benefit you're paying for. Always choose natural vitamin E, specifically labeled as D-alpha tocopherol, not DL-alpha. Check your supplement labels carefully. This single detail can be the difference between significant results and wasted money. The optimal dose for supporting healthy blood flow and clot prevention is between 400 and 800 international units daily, taken with a meal that contains some fat. Vitamin E is fat-soluble, meaning it needs dietary fat for proper absorption. Taking it on an empty stomach or with a fat-free meal means most of it passes through your system unused. Here's the powerful synergy almost nobody knows about. Vitamin E works dramatically better when combined with vitamin K2, and this combination is safer than vitamin E alone. This sounds contradictory because vitamin K is known for helping blood clot. So why would you combine a clot-dissolving vitamin with a clotting vitamin? Here's the brilliant truth. Vitamin K2 doesn't promote dangerous clots in your veins. Instead, it regulates where calcium gets deposited in your body, directing it to your bones and teeth, while preventing it from accumulating in your arteries and soft tissues. Calcified, stiff arteries are prone to clot formation because blood doesn't flow smoothly through them. By keeping your arteries flexible and calcium-free, vitamin K2 actually reduces clot risk while allowing normal, healthy clotting when you're injured. The combination of vitamin E at 400 to 800 IU daily plus vitamin K2 at 100 to 200 micrograms daily creates a balanced approach. Vitamin E prevents excessive clotting and supports clot dissolution, while vitamin K2 maintains arterial health and prevents the calcification that promotes clots. Together, they create an environment where your circulation flows freely and your natural clot-dissolving mechanisms work optimally. Now let's add the third critical nutrient that completes this powerful trio, Nattokinase. This is an enzyme derived from natto, a traditional Japanese fermented soybean food. Nattokinase has been extensively studied for its ability to break down fibrin directly, the protein that makes up the structure of blood clots. Think of fibrin as the scaffolding of a clot. Nattokinase dismantles that scaffolding. Research shows that nattokinase can reduce fibrin levels in the blood, improve circulation, and even help dissolve existing small clots over time. It's been used in Japan for decades as a natural approach to cardiovascular health, and Western research is finally catching up, confirming its effectiveness and safety. The effective dose of nattokinase is typically 2,000 to 4,000 fibrinolytic units daily, taken on an empty stomach for best absorption. This is crucial. Take it at least 1 hour before meals or 2 hours after. When taken with food, digestive enzymes can break down nattokinase before it enters your bloodstream, negating its benefits. So here's your complete protocol for supporting healthy circulation and natural clot dissolution. Take 400 to 800 international units of natural vitamin E, D-alpha tocopherol, with a meal containing healthy fats like avocado, nuts, or olive oil. Take 100 to 200 micrograms of vitamin K2, specifically the MK7 form, which is most bioavailable and longest lasting, and take 2,000 to 4,000 FU of nattokinase on an empty stomach, ideally first thing in the morning or before bed. This combination addresses clot formation and dissolution from multiple angles. Vitamin E reduces platelet stickiness and supports your natural fibrinolytic system. Vitamin K2 maintains arterial flexibility and proper calcium metabolism. Nattokinase directly breaks down fibrin. Together, they create a comprehensive approach that's greater than the sum of its parts. But let me give you the critical warnings that could save your life. Never start this protocol if you're already taking prescription blood thinners like warfarin, Coumadin, Plavix, or any other anticoagulant without explicit approval from your doctor. Combining natural blood-thinning supplements with prescription medications can cause dangerous bleeding. Your doctor may need to adjust your medication dose if they approve adding these supplements, and you'll need careful monitoring. Similarly, stop all blood-thinning supplements at least 1 week before any surgery or dental procedure. Even natural supplements can increase bleeding risk during and after procedures. Inform your surgeon and anesthesiologist about everything you're taking, including vitamins and supplements. If you notice any unusual bleeding, bleeding gums when brushing, frequent nosebleeds, easy bruising, or blood in urine or stool, stop the supplements immediately and contact your healthcare provider. These could be signs that your blood is becoming too thin. Now let's talk about lifestyle factors that work synergistically with these supplements to protect you from blood clots. First and most important is movement. Sitting for extended periods is one of the biggest risk factors for leg clots because blood pools in your lower legs when muscles aren't contracting to pump it back up. If you have a desk job or spend hours sitting, stand and walk for at least 5 minutes every hour. When you're up, do ankle circles and calf raises to activate the muscle pump in your lower legs. On long flights or car trips, wear compression socks rated at 15 to 20 millimeters of mercury. Do seated leg exercises every 30 minutes and walk the aisle or stop to walk whenever possible. Hydration is equally crucial. Dehydration thickens your blood, making clots more likely. Drink at least 8 glasses of water daily, more if you're active or in hot weather. Your urine should be pale yellow, not dark. Dark urine means you're dehydrated and your blood is thicker than optimal. Certain foods also support healthy blood flow and natural clot prevention. Omega-3 fatty acids from wild-caught fish like salmon, sardines, and mackerel have natural blood-thinning properties. Garlic contains allicin, which reduces platelet aggregation. Ginger has anti-inflammatory compounds that support vascular health. Turmeric with black pepper improves circulation and reduces inflammation that can damage vessel walls. On the flip side, avoid foods that promote inflammation and blood thickening. Excessive omega-6 fatty acids from vegetable oils, processed foods, and fried items create an inflammatory environment that encourages clot formation. Trans fats damage blood vessel linings. Excess sugar increases inflammation and makes blood more viscous. Let me share the story of Margaret, a 64-year-old woman who came to me concerned about her family history of blood clots. Her mother and sister had both suffered deep vein thrombosis, and Margaret was terrified she'd be next. She had early warning signs: frequent leg heaviness, mild swelling by evening, and visible spider veins. I put her on the complete protocol: natural vitamin E, 400 IU with lunch, vitamin K2 100 micrograms with dinner, and Nattokinase 2000 FU first thing each morning. I also had her implement hourly movement breaks, increase her water intake, add omega-3 fish 3 times weekly, and wear compression socks during her work shift as a retail manager. Within 6 weeks, Margaret's leg heaviness diminished noticeably. The evening swelling reduced significantly. Her energy improved because better circulation meant better oxygen delivery to her tissues. 8 months later, she had a comprehensive vascular ultrasound that showed no evidence of clots and healthy blood flow throughout her legs. She continues the protocol as prevention, and she's no longer living in fear of her family's clotting history. Now, I need to talk about recognizing the signs of an actual blood clot because early detection can be life-saving. A clot in your leg, deep vein thrombosis, often presents with sudden swelling in one leg, not both. The affected leg may feel warm to touch, appear red or discolored, and cause pain that worsens when you flex your foot upward or walk. If a clot breaks free and travels to your lungs, causing a pulmonary embolism, symptoms include sudden shortness of breath, chest pain that worsens with deep breathing, rapid heart rate, coughing up blood, and feeling lightheaded or faint. This is a medical emergency requiring immediate hospital care. Do not wait. Do not try home remedies. Call emergency services immediately. Certain factors increase your clot risk dramatically and require extra vigilance. Recent surgery, especially orthopedic procedures on hips or knees, significantly raises risk for weeks afterward. Prolonged bed rest or immobility from injury or illness allows blood to pool and clot. Cancer and cancer treatments can make blood more prone to clotting. Pregnancy and the postpartum period change blood chemistry in ways that increase clot risk. Hormone replacement therapy and birth control pills, especially in smokers over 35, substantially increase risk. If any of these apply to you, you need medical supervision for clot prevention, not just supplements. Your doctor may prescribe preventive anticoagulation, compression devices, or other medical interventions. The natural protocol I'm describing is for general prevention in healthy individuals, not for high-risk medical situations. Let's also address varicose veins because many people confuse them with clot risk. Varicose veins are enlarged, twisted veins visible under the skin, usually in the legs. They result from weak vein walls and faulty valves that allow blood to flow backward and pool. While uncomfortable and unsightly, varicose veins themselves don't typically cause dangerous clots. However, the conditions that lead to varicose veins, poor circulation, venous insufficiency, can contribute to clot risk over time. So supporting your vein health with these same nutrients, especially vitamin E and Nattokinase, can help both conditions. Adding horse chestnut extract and diosmin, two botanicals specifically studied for vein health, can further support varicose vein improvement. Another important consideration is inflammation, the hidden driver behind so many clots. Chronic inflammation damages blood vessel linings, and damaged areas are magnets for clot formation. Reducing systemic inflammation through diet, stress management, adequate sleep, and anti-inflammatory supplements protects your vessels and reduces clot risk. Curcumin from turmeric is a powerful anti-inflammatory that also has direct effects on platelet function. Omega-3 fatty acids reduce inflammatory markers throughout your body. Green tea contains compounds that protect vessel walls from oxidative damage. A comprehensive anti-inflammatory lifestyle strategy amplifies the effects of your clot prevention supplements. I also want to address a common concern. Can you take too much vitamin E? Yes, absolutely. Very high doses of vitamin E, above 1,000 IU daily for extended periods, can interfere with vitamin K function and potentially increase bleeding risk. Some studies have also suggested that very high doses might increase certain health risks in specific populations. This is why I recommend the moderate, effective range of 400 to 800 IU, which provides benefits without pushing into potentially problematic territory. Quality matters tremendously with these supplements. Look for vitamin E from non-GMO sources, preferably derived from sunflower or mixed tocopherols that include not just alpha, but also beta, gamma, and delta tocopherols for broader antioxidant protection. For vitamin K2, choose the MK7 form derived from natto for best absorption and longest activity. For Nattokinase, select products that clearly state the fibrinolytic unit content and are made from non-GMO soybeans. Store your supplements properly to maintain potency. Vitamin E is sensitive to light and heat, so keep it in a cool, dark place, not in a bathroom cabinet where heat and humidity degrade it. Check expiration dates and don't use supplements that smell rancid, a sign that the oils have oxidized and lost effectiveness. Here's a timeline for what to expect when you start this protocol. In the first week, you likely won't notice dramatic changes, though some people report feeling slightly more energetic as circulation improves subtly. By weeks 2 to 4, you may notice reduced leg heaviness or swelling if those were issues. Your skin may look healthier as microcirculation improves. By weeks 6 to 8, if you had symptoms of poor circulation, cold hands and feet, slow wound healing, or leg discomfort, you should see noticeable improvement. For actual clot dissolution, understand that small clots can resolve over weeks to months with this natural approach, but this must be monitored medically. Never assume a clot is dissolving without medical imaging confirmation. Large or dangerous clots require immediate medical treatment with prescription anticoagulants and possibly clot-removing procedures. Let me give you one more crucial piece of information. Certain genetic conditions make some people more prone to blood clots. Factor V, Leiden, prothrombin gene mutation, and antiphospholipid syndrome are examples of inherited clotting disorders. If you have a personal or family history of unusual clots, especially at young ages or in unusual locations, ask your doctor about genetic testing. If you do have a clotting disorder, you may still benefit from these supplements under careful medical supervision, but you'll likely also need prescription anticoagulation. The natural approach can complement but not replace medical treatment in these cases. Before we close, here's your action plan. If you're over 40, have risk factors for clots, or simply want to support optimal circulation, start with the foundation. Natural vitamin E, 400 to 800 international units daily with a fatty meal, vitamin K2 100 to 200 micrograms daily, and Nattokinase 2000 to 4000 FU on an empty stomach. Add lifestyle factors, hourly movement if you sit a lot, adequate hydration, anti-inflammatory foods, and compression socks for long travel. Track your symptoms if you have any. Note: leg heaviness, swelling, or discomfort. After 6 weeks, assess whether you've noticed improvement. Most people do. Continue the protocol long-term for ongoing protection, adjusting doses only with healthcare provider guidance. If you're currently symptom-free, these supplements and lifestyle practices are excellent prevention, keeping your blood flowing smoothly and your natural clot-dissolving system working optimally. Prevention is always easier than treatment, and when it comes to blood clots, prevention can be life-saving. Your circulation is fundamental to every aspect of your health. Every cell in your body depends on blood flow for oxygen and nutrients. Your brain, your heart, your muscles, your organs, all rely on blood moving freely through healthy vessels. Supporting that circulation with targeted nutrition and smart lifestyle choices is one of the most important things you can do for longevity and vitality. Blood clots don't have to be an inevitable consequence of aging, long flights, or genetics. With the right knowledge and the right tools, you can support your body's natural ability to maintain healthy blood flow and dissolve small clots before they become dangerous. Vitamin E, K2, and Nattokinase are powerful allies in this mission, backed by solid research and real-world results. Starting today, you have the knowledge to protect your circulation naturally. Share this information with family members who might be at risk, especially those with sedentary jobs, long commutes, or family histories of clotting. This simple protocol could prevent serious complications and save lives. Remember, your health is your most valuable asset, and your circulation is the delivery system for everything your body needs to thrive. Protect it, support it, and give it the nutrients and lifestyle it needs to keep you moving, active, and vital for decades to come. Here's to healthy blood flow, clear vessels, and the peace of mind that comes from taking proactive care of your vascular health. See you in the next video.